Welcome to the Home Sleep Apnea Testing instructional video. This video will provide an overview of home sleep apnea testing and the two main types of devices used for testing. We will also review general information for what to do before, during, and after your home sleep apnea test. What is a home sleep apnea test? A home sleep apnea test is a way for your sleep provider to determine if you have obstructive sleep apnea, or OSA, which is the most common breathing disorder during sleep. The test is conducted at your home, usually over one night, using a portable, battery-operated device you wear on your body that monitors and records several indicators while you sleep. The data recorded will help your provider gain a better understanding of what goes on with your breathing while you sleep, and make recommendations for treatment if needed. There are multiple advantages to this type of testing. Home sleep apnea testing has been shown to be a safe, accurate, and convenient alternative to an overnight sleep test performed at a facility. By testing at home in your natural sleeping environment, you can keep to your usual sleep schedule. Home sleep apnea testing uses less sensors than a facility-based sleep test and often can be completed in a timelier manner. In general, there are two types of home sleep apnea testing devices. The first type of device, a cardiorespiratory monitoring device, has multiple sensors to record breathing, respiratory muscle movement, oxygen levels, and heart rate. A second type of home sleep apnea test is a watch-like device, which uses a unique technology to monitor blood vessel changes to determine if breathing pauses are occurring during sleep. This device also monitors your heart rate and oxygen levels to help determine if you have sleep apnea. Depending on the center, an optional chest sensor may be used to measure noise levels, typically snoring and body position. Your sleep provider will determine which device is most appropriate for you. Once your healthcare provider has requested a home sleep apnea test, you will receive the testing kit generally in one of three ways: at the time of your clinic visit, by mail, or you may be asked to pick up your testing kit at your VA sleep center. Your provider or sleep center staff will inform you as to how you will obtain your device. When you receive your test kit, be sure to open the kit and review the enclosed instructions for setup as soon as you have the opportunity. If it appears that any of the parts to the test kit are missing, notify the sleep center. It is best to review instructions early so you get comfortable with the steps. Please complete the test within the first couple days to ensure full battery power for your test and the timely return of the device. Additional information is available on the Path to Better Sleep website to assist you with the setup of your home sleep apnea test. Two videos are available that cover step-by-step instructions for the setup of two common testing devices. On the day of your test, keep to your usual routine during the day and avoid napping if possible. Be sure to allow for adequate time for sleep, at least 6 hours wearing the device. Avoid caffeine and alcohol. Most of the testing devices use a sensor that fits over one of your fingers, called a finger probe or an oximeter. It is important to remove any nail polish or acrylic nail from your test finger and trim the nail if long. This will ensure a good signal from the fingertip and correct positioning of the finger in the probe. Keep to your regular bedtime routine as much as possible. For example, if you usually take a bath before bed, do so before applying the test equipment. Wear a t-shirt or comfortable clothing to bed. Avoid wearing jewelry and using hand cream, as these can interfere with the test. If you take prescribed medications at bedtime, including sleep medications, take them as you would normally do prior to the start of the test. Be sure to allow 10 to 15 minutes to set up the device prior to sleep. During the test, sleep in your usual body position. Feel free to change your sleep position if you desire. If you awaken during the test or need to use the restroom, do not turn off the device. Keep all equipment on and in place. Avoid getting the equipment wet. For example, if you wake during the night to use the restroom. If the sensor becomes detached during the night, reattach it as soon as you notice it and try to resume sleep. After your test is complete, remove all testing equipment and place in the original bag. Do not discard any equipment. Your provider may have included paperwork for you to complete about your sleep. If so, please complete it and return with the device. Return the testing device based on your sleep center's instructions. You may have been provided a prepaid mailer to return the device, or you may need to drop it off at your VA sleep center. It is very important that you return it as soon as possible. Once your test has been interpreted by a sleep physician, you will be notified of your results either at a follow-up appointment or by phone, by My Healthy Vet secure messaging, or by regular mail, depending on your sleep center's protocol. If your test shows sleep apnea, your provider may recommend that you schedule a clinic appointment to discuss the findings and options for treatment. However, depending on the severity of your sleep apnea, your provider may recommend you start treatment before your follow-up visit or schedule a facility-based treatment sleep study. Good luck. We look forward to partnering with you to help you achieve better sleep.